The Ministry of Health will be instituting a new policy. Members of the press, and members of the public, I think this is important. We'll be introducing a new policy from April 15th, 2024. So we're giving adequate notice that going forward, our hospital pharmacy, that is the pharmacy at the Alexandra Hospital, will only be accepting and filling prescriptions generated within the public health facilities in Nevis. Namely, the Alexandra Hospital, the Flamboyant Nursing Home, our health centers, our Nevis Eye Clinic, our dental unit, and our Behavioral Health and Wellness Center. These prescriptions must be on the facility prescription pad and must bear the facility stamp. Fees still apply to those who are not in the current exemption category. Now, why is that important? That is important because what is currently happening in Nevis, as you know, medication provided at the hospital is heavily subsidized. And what is currently happening is that there's been a breakdown in the system so that our hospital is being asked to fill prescriptions no matter where they come from, including prescriptions from St. Kitts. And private doctors are being filled at our hospital here. I am advised that we are currently accepting all prescriptions, those generated from within the Ministry of Health, as well as facilities on St. Kitts, and those generated from private institutions. We're dispensing on average 1,000 prescriptions monthly. Of that number, up to 45% are generated by private physicians. Now, this is creating a number of problems. One, the cost to the NIA. Two, the private pharmacies are now complaining and saying that because of our practice, it is putting them out of business. And that clearly is not how the system is designed to be. Incidentally, we are told that the pharmacy at the JNF Hospital in St. Kitts only accepts prescriptions generated from the public health facilities. So what we're doing is adopting a policy now similar to that applies on St. Kitts, to say that if you go to the hospital pharmacy, your prescription must have been generated from a public health facility, government-run facility. Now, we're no longer prepared to accept prescriptions there that are generated from your private health practitioners or prescriptions generated from your doctors on St. Kitts, for example. You must take those to your private pharmacy for that private pharmacy to fill those prescriptions. We understand that there will be some teething pains, as is expected, but we're asking the public's understanding in the circumstances. We do not want our private pharmacies to go out of business, and we cannot continue with this heavily subsidized arrangement for the entire community. So